ಮೇಡಮ್ ಸ್ಟಾರ್ಟ್ ಮಾಡ್ರಿ ಚಾರ್ಜ್ ಖಾಲಿ ಆಗುವಂತ ನನ್ನ ಫೋನ್ಯಾಗ.
Hi all, we will start our class within few minutes, okay?
ಓಕೆ ಮ್ಯಾಮ್.
Yeah, now it's time to start our section. A very good afternoon, everyone, and welcome to this revision section of your upcoming examination. My name is Avina, and I will be your host for today. We are here to ensure that you feel confident and prepared as you tackle these important subjects. Throughout this interactive section, we will revisit key concepts and address any questions you might have. Before we begin, let's go over a few quick guidelines. Please keep your microphones muted unless you are asking a question to avoid background noise. Feel free to use that chat feature to post your queries or thoughts during the section. We encourage active participation, so don't hesitate to speak up if you need clarification. Thank you all for being here, and let's make this a productive and insightful section. Without further delay, let's dive into the topics.
Hi, good evening all. Am I audible to you? Hello,
Yes,
students, am
yes.
I audible? Okay, so good evening all. Today we are having a revision section of Medical Surgical Nursing 2. Yesterday, you people already got an idea about Medical Surgical Nursing 1. So, in this section, let's discuss about Medical Surgical Nursing 2 syllabus and some important topics.
Okay, ma'am. In total, they are having 11 units in medical surgical too. So we can discuss one by one. So I will tell you some important topics and questions from each unit. So your first unit is oncological nursing. So what is oncology? Any answers? This is an interactive section. You can say the answers. Anyone? So ma'am, what is oncology?
Actually, oncology is the study of cancers, right?
Yeah, oncology means the study and treatment of cancer. So, in this unit, we are going to study about different kinds of cancers, etiological factors, and how the cancer is affecting the human body. That means the pathophysiology, different diagnostic measures to identify cancer, and treatment modalities like immunotherapy, gene therapy, radiation therapy, chemotherapy, bone marrow transplantation. These all are we are discussing in this unit. So you can expect some questions like what are the warning signs of cancer? What is leukemia? What do you mean by cervical cancer? And the drug therapy for cancer treatment like chemotherapy. So I will ask you a question. What is leukemia? That's an important question that may be asked for 5 months. What is leukemia? Anyone? Any answers? Leukemia. So, leukemia is a type of cancer which is affecting the blood and bone marrow. In this condition, the WBC count will be low and the treatment options will be limited. So, what are the treatment options for leukemia?
or by lying down in a flat surface. You can just do the palpation, and if there any changes is there, you can assess that. Okay. So there are some breast disorders like mastitis, breast abscess, and gynecomastia. So these questions may ask us two more questions. The definition, define gynecomastia, define breast abscess. So what is gynecomastia? What is gynecomastia?
Enlargement of the
Any
male breast.
answers? Yes, that is an non-cancerous condition causes an increase in breast size, mainly in males. That is the correct answer. It is an non-cancerous condition causes an increase in breast size, mainly in males. So you can expect any definition of any conditions for your upcoming exams. So this is about the disorders of breast.
Okay. Your next unit is disorders of integumentary system. So, what is integumentary system? Integumentary system. Any answers?
You can use the chat box also. If you know the answer, please just type that one. What is integumentary system?
Okay. It is nothing but the skin. So, in this unit, we are going to discuss about various disease conditions which are affecting the skin. Psoriasis, alopecia, herpes zoster, scabies are some important topics from this unit. Once again, I will tell psoriasis, alopecia, herpes zoster, scabies are some important topics from this unit. So, what is psoriasis? Psoriasis. Definition of psoriasis. Okay. Psoriasis is a chronic autoimmune condition. It is a chronic autoimmune skin condition characterized by thick, red, and inflamed patches on the skin. So, psoriasis is a chronic autoimmune condition which is characterized by thick, red, inflamed patches will appear on the skin. That is psoriasis. In the same unit, we are having another important topic that is burn. So, what is burn? Burn. Any answers? Ma'am, what is burn?
Actually, this burn is the skin damage, mainly affecting the skin layers, maybe the muscles and the adjacent organs by direct heat or radiation or by chemicals.
Yeah, that's the right answer for burns. So, moving to next, it is calculating the intensity of burn is an important question. That is rule of 9. For 5 marks, it may be asked. So, already the rule of 9 is presented in the PPT. You can check that one. I will explain it. So, in rule of 9, we are calculating the intensity of burn. So, the head and neck is calculated as 9 percentage. Each arm is 9 percentage. Chest, abdomen, and back is 36 percentage, and each legs is 18 percentage, and at last the 1 percentage is growing. Did you understand? That's how we are calculating the intensity of burn. So once again I will tell the head and neck is calculated as 9 percentage. Each arm is calculated as 9 percentage. Chest, abdomen and back is 36 percentage, Each leg is 18 percentage and the growing is 1 percentage. It will be a sure question for your examination, rule of 9. While writing the exam, you have to draw a neat and label diagram while explaining the rule of 9. It will be easy for you to score more marks. Avoid an immediate care for burns as a 5 mark question or short note question. That's all about your integumentary system. Moving to next unit.
Okay, and moving to your next unit, that is ophthalmic nursing. Okay, from this unit, you will get an idea about diseases or disorders of eye, and as a nurse, how you provide care for such patients with eye disorders. So, in this unit, we are detailing studying about infection and inflammation of the eye, that are conditions like blepharitis. So, what is blepharitis? Any idea? Blepharitis.
Infection,
So the
inflammation of the margin
blepharitis
of the
is the
eyelid.
infection of eyelids. Sorry, can you please repeat that?
Infection, inflammation of the margin of the eyelids.
Yes, that is the answer. Very good. Infection of the eyelids. It is mainly associated with bacterial infection. That is blepharitis. Next is conjunctivitis. As you know, it is the infection of conjunctiva. And next is keratitis. So, what is keratitis? What is keratitis?
Inflammation of the eyelid.
It is not the inflammation of eyelid, it is the inflammation of cornea. Keratitis is the inflammation of cornea. So, these are the infection and inflammatory conditions of the eye. And in the same unit, we are going through rehabilitative and preventive care. Okay. In the same unit, we are discussing about the programs, national programs related to blindness. Okay, you can expect these questions: national programs on blindness, rehabilitative and preventive care for blind people. These questions may ask for 5 mark or 2 mark. So you have to give a proper answer for these kind of questions. They may ask the definition of eye disorders like a defined trachoma, name some ocular emergencies. So, what are ocular emergencies? Ocular emergencies. Any answers? Ma'am, ocular emergencies?
The ocular emergencies are glaucoma, acid burn, foreign bodies, and trauma.
Yes, the trauma of the eye. So, once again, I repeat that are glaucoma, foreign body, acid burn, and trauma of the eye. These are the ocular emergencies. These questions may come for one word answers or filling the blanks. They may ask questions like that. Okay, these are about the ophthalmic nursing.
So, moving to your fifth unit, that is disorders of ear, nose, and throat. So, first we can tell about or discuss about the conditions which are affecting the ear. So, what are the common conditions affecting ear? Any idea? The common conditions affecting the ear.
Any answers?
Hmm.
Otitis media.
So, you all heard about otitis media, right? Yes.
Yes, good. So, the first condition is otitis media. What is otitis media?
Biliary infection.
Inflammation of the inner ear.
Otitis media. Okay. Yeah, that's the right answer. So it is the infection of the middle ear. So the second one is mastoiditis. Mastoiditis. What is mastoiditis? Mastoiditis.
Excuse me, ma'am.
It's the infection of
Excuse
the
me.
mastoid cells.
Excuse me.
Yes.
Excuse me. Adira, please stop sharing your screen. Adira, please stop sharing your screen. Okay. Okay, please continue.
Okay. The second one is mastoiditis. So mastoiditis means the infection of the mastoid cells present in the ear. So the next one is labyrinthitis. Any answers? What is labyrinthitis? Labyrinthitis. Okay, it's the infection and inflammation of the inner ear. In the same unit, there is one important topic that is Meniere's disease. Meniere's disease. So, what is Meniere's disease? It is one of the disorder of inner ear. In this condition, the patient may lose the balance and the hearing activity. In the Meniere's disease, the patient will lose the hearing activity and body balance. So that is Meniere's disease.
The next topic is nose, right?
Yes.
So next is nose. So what are the diseases affecting the nose? Any idea?
Rhinitis.
Rhinitis. Yes,
Epistat
rhinitis.
epistaxis.
Epistaxis next. Yeah, good. So the conditions that affecting are rhinitis, sinusitis, and next important one is nasal septum deviation. Nasal septum deviation, and next is the trauma of the nose. There are so many times in your question paper, this question is repeated. The management of nose bleeding. The management of nose bleeding. What is the emergency management of nose bleeding? Emergency management of nose bleeding. Any answers? Management of nose bleeding. If a patient is coming with nosebleed, what is the first aid or what you will do in the first section? Any idea? Ma'am, are you having an idea?
Yes, ma'am. When one patient is coming to the hospital with nose bleeding, first we have to give priority for positioning the patient. So first we have to place the patient's head in upright position so that the bleeding will be less. Second one we have to do is we want to pinch the nose. We want to close the nose with our thumb and
Index
index
finger.
finger. So after that, we can give cold compress, means ice
Bag.
packs or cold cloths we can apply to the bridge of the nose. Then we have to give advice to the patient not to rub the nose.
Okay. Is that clear? Emergency management of nose bleeding. Is that clear? Those who want to note down, I will explain that once again. Place the patient in upright position. Pinch the soft part of the nose using your thumb and index finger. Next is cold compress application. Next is advice to not to rub the nose.
By rubbing the nose, the bleeding will increase.
Okay, is that clear? So the next section in ENT is disorders of throat. Next is the disorders of throat. So in this section, what are the disorders associated with throat?
Upper respiratory tract infection, lower respiratory tract infection.
Upper respiratory tract infection. Good. Okay. Lower respiratory, it's coming to the lungs. So in the throat, it's coming pharyngitis, adenoiditis. Yes or no?
Yes, ma'am.
Okay. So the conditions like tonsillitis, pharyngitis, adenoiditis, these are the conditions coming in the throat. This they may ask the definition, or they may ask like that. What are the throat disorders? Okay, they may ask like that. Most probably, they will ask for the definition of some particular conditions. So be thorough with the definition of medical conditions. Okay.
So moving to our next unit, that is cardiovascular diseases. So in this unit, we are focusing on the disorders which are affecting the circulatory system. From this arrhythmia,
Am I audible? Hello. Okay.
Audible, ma'am.
okay. So in the disorders of okay, in the disorders of circulatory system, first you have to know what is arrhythmia. What is arrhythmia? Anyone? Any answers? Okay, arrhythmia is nothing but the irregular heartbeat or abnormal heart rhythm. The irregular heartbeat is known as arrhythmia. So it includes tachycardia, bradycardia, atrial fibrillation, and ventricular fibrillation. So the arrhythmia is the irregular heartbeat. The irregular heartbeat is known as arrhythmia. So it includes tachycardia, bradycardia, atrial fibrillation, and ventricular fibrillation. Moving to next topic, that is valvular heart disorders. Valvular heart disorders, which includes mitral valve stenosis and aortic valve stenosis. So the main two conditions coming under valvular heart disorders are mitral valve stenosis and aortic valve stenosis. What is mitral valve stenosis? Mitral valve stenosis. It's the narrowing of the mitral valve, the valve between left atrium and left ventricle. It is known as mitral valve. The narrowing of mitral valve is known as mitral valve stenosis. In this condition, the blood flow from left atrium to left ventricle will decrease. So in mitral valve stenosis, the mitral valve becomes narrowed so that the blood flow from left atrium to left ventricle will be decreased. Same like that in aortic valve stenosis, the aortic valve will be narrowed. Here, the aortic valve will be narrowed so that the blood from left ventricle to other body parts will be decreased. So that's the difference between mitral valve stenosis and aortic valve stenosis. They may ask questions for 5 marks. Just note that one. Next is the infection and inflammation affecting the heart. That pericarditis, myocarditis, and endocarditis. Pericarditis, myocarditis, and endocarditis. These are the infections which are affecting the layers of heart. So, what are the layers of heart? You have already studied in your anatomy and physiology. I have
Yeah.
given you one clue also. So, what?
So next move to the next section, that is hematological disorders. Okay, so what is hematological disorders? Hematological disorders, these are the disorders associated with blood or blood disorders. So first one is anemia. First one is anemia. So what is anemia? What is anemia?
Anemia is a blood
What is
disorder.
anemia? Any idea?
Low level blood in a bone marrow.
Level.
Yes.
Low level blood in a bone marrow.
Yes, low level of hemoglobin or HB or decrease in the number of RBC. That is anemia. That is anemia. So next important topic is thalassemia and polycythemia. Leukemia already explained in the oncology chapter. Thalassemia is very important in the hematology, and some bleeding disorders are there. What are the bleeding disorders? Anyone can name some bleeding disorder? Bleeding disorder. So bleeding disorders are sickle cell anemia and hemophilia. Sickle cell anemia and hemophilia. These are the bleeding disorders. These questions may ask for short note. That will be for 5 marks. So please be thorough with sickle cell anemia and hemophilia. Okay, is that clear? Is that clear? Students, is that clear?
Yes, ma'am. Continue.
Can I continue?
Continue, ma'am. Continue.
Okay. So moving to the next, that is okay. Moving to the next, that is communicable diseases. Okay, what are the communicable diseases? Communicable diseases. What are the communicable diseases?
Spread one person to other person by air.
Yes, that is that. By air or by any pathogens. So the communicable diseases are the infections which affect one person to another by the transmission of pathogens. So in this unit, we are detailing studying about communicable diseases and its management. Okay, we can classify the diseases according to the type of pathogen. So what are the types of pathogen, ma'am?
Mainly, it is affected by bacteria, viruses, and in community basis, it is mainly caused by the vectors.
Vectors. So the first classification is viral diseases. So what are the viral diseases? Viral diseases. The diseases caused by virus. Can you please name some viral diseases?
Tuberculosis.
No virus.
You can check with the PPT.
It's already in the slideshow.
Ebola
Yes,
virus.
that is measles, chickenpox, mumps, rubella, yes, AIDS, poliomyelitis, and etc. So next classification is the infections caused by bacteria. So, what are the bacterial diseases? Bacterial diseases that are typhoid, diphtheria, cholera,
Pneumonia.
tuberculosis, plague, etc. So, next category is the vector-borne diseases. What are vector-borne diseases? Vector-borne,
malaria,
vector-borne diseases. Dengue. So these are the vector-borne diseases.
In that, we are detailing studying about the sexually transmitted diseases like gonorrhea, syphilis, AIDS, and herpes. So, the main topics are gonorrhea, syphilis, AIDS, and herpes. So, I'll ask you one question. What is syphilis? What do you mean by syphilis? Already I told you it's a sexually transmitted disease. Yes, good. So, syphilis is a bacterial infection usually spread by sexual intercourse that start with a painless sore. A sore will be appeared in the genital area. So that is syphilis. In the same section, we are discussing about the sexual hygiene and sexual health. Moving to the next unit, that is musculoskeletal disorders. Musculoskeletal disorders. In this unit, we are studying about the infection and inflammation in the skeletal system. So, we are studying about the infections and inflammations which are affecting the skeletal system, mainly arthritis, osteomyelitis, and TB affecting the spine. So, the important topics are arthritis, osteomyelitis, and TB affecting the spine. So, what is arthritis? Arthritis. Any answers? Arthritis?
Inflammation of the joint.
Yes. It is the chronic inflammatory condition of the joint. So, arthritis is the chronic inflammatory condition of the joint, so that the patient will have severe pain, stiffness, and swelling in the joints. In arthritic patients, they will have severe pain, stiffness, and swellings in the joints. In the same unit, the another important topic is fracture. So you need to study about fracture. Then next is range of motion exercises are also a probable question from the same unit.
Okay, moving to our next unit, that is emergency management. Emergency management. In this unit, we are detailing studying about principles of emergency care. So, what are the principles of emergency care? Principles of emergency care. The first one is triage. So, in triage, what we are doing means determining the severity of a patient's condition. We are assessing the severity of the patient's condition and providing immediate treatment according to the severity of the patient. Okay. Next principle is the airway management. We have to assess the airway, condition of airway of the patient, especially in the children. Okay. Next, the third one is CPR. So, third principle is CPR. We will provide CPR to ensure the oxygen supply to the brain. when we are giving CPR, the oxygen will easily reach the brain and it will prevent the brain cell damage. Okay. The fourth principle is monitoring. So, what we are monitoring? We are assessing the patient and monitoring the vital signs, and we are focusing on the patient's changes. So, the last one is the first aid care. So, what care we are providing in the primary section, which include oxygen therapy. These are the principles of emergency medicine. Am I audible? Hello?
Yes, ma'am. Ma'am,
Okay. Okay.
voice
The
doesn't.
first principle is triage. Second one is airway. Sorry, can you please repeat?
Ma'am, voice doesn't
Hello?
clear. Ma'am, voice not clear, ma'am.
Hello, is that clear?
Clear, ma'am, clear.
Am I audible?
Audible, ma'am.
Okay.
Continue.
Okay. Okay. The first principle is in emergency management is first one is triage, second one is airway management, and the third one is CPR, fourth one is monitoring, and the fifth one is primary care. Okay. So, in the same unit, we can expect some questions like management of frostbite. So, what is frostbite? Frostbite. So, frostbite is a condition in which when the skin and tissues freeze due to prolonged exposure to cold compress. Okay. In the too much cold conditions, our skin and tissues will be freezed. Okay. So, you may get some questions like management or define frostbite or management of frostbite. So the management will be move the patient to a warm place, remove the wet clothes, warm the affected area, and give some pain relief measures to the patient. Okay, is that clear? Is that clear?
Yes, ma'am. It's clear.
Okay. The last unit is disaster nursing. Okay. The last unit is disaster nursing. So, in this unit, we are studying about natural calamities and man made disaster. What are the disaster? Natural calamities. Can you please mention anything? Natural calamities.
Earthquake,
Earthquake.
What are natural calamities? Earthquake, earthquake,
tsunami,
earthquake, flood, war,
Tsunami.
fire. This war, fire, and accidents are
tsunami,
these are okay. These are man-made one. Okay. So from this portion, they may ask the role of nurse in disaster management. Maybe they will mention any disaster or any natural calamities. What is the role of nurse in an earthquake situation, or what is the role of nurse in a war? So we should know as a nurse what to do in a disaster nursing. So, what are the role of a nurse in disaster management? The first one is immediate care for victims. We should provide care for the injured persons. Next is the psychological support. We should provide psychological support to the patients, those who are affected in the natural calamities or those who are affected in the disaster. We should provide psychological support. And next is the education. We should give education to the persons. Why? Because they will be not aware about what to do next. So we should give education regarding their present condition. Okay. Next is the community assessment. Why should we give a community? Why should we do community assessment? There is a high risk to get uh, some diseases, community spread diseases. So we should analyze the risk of community spread of diseases. So next is the training and education for people in the community. We should educate, train, and we should provide psychological education also. So this is about your emergency and disaster nursing. Is that clear? Is that
Yes,
clear?
ma'am. Yes, ma'am.
Yes, ma'am.
Do you want to repeat anything? Okay. Okay, this is all about your 11 units. This is your entire medical surgical nursing 2 syllabus. So, these all are the topics coming under in this subject. So, shall we move to the question paper discussion?
Yes, ma'am.
Yes, yes, ma'am.
Yeah, before moving on to the next section, we are
Okay.
very excited to say that our Nursing Guru app provides expert video lessons, quizzes, and live sections to help you prepare effectively. Whether you are studying for competitive exams or improving your skills, Nursing Guru makes learning easier and more accessible. With expert guidance, interactive lessons, previous year question paper, and practice tests, our app is designed to help you succeed. So, don't forget to download our Nursing Guru and start your journey towards exam success. If you have any questions, feel free to reach out. Happy learning.
Thank you.
Yeah, ma'am, please continue with your question answer section.
Okay. Okay, moving to your question paper discussion. Your MSN II is for 3 hours and the maximum score will be 75. You have to attend the total of 30 questions. First, you will have the potassium, value of potassium is 3.5 to milligram per liter. So you need to write the answer only, no new explanations. So under that you need to give under that the next under that you need to read that one thoroughly. Then only you can give the answers. So here the question is X-ray is a painful procedure. Like that, the statements will be given in the question paper. You need to read it and give the answers. The question is X-ray is a painful procedure? No. So the answer is false. Like that, you need to answer the question papers. Your timing will be 3 hours. In this 3 hours, you need to complete the 30 questions. So time management is very important while writing the examinations. Good luck for your
Ma'am,
exams.
in medical surgical,
If anyone are having any doubt means you can ask now.
Okay.
ma'am, in medical surgical, any diagram was needed?
explained the rule of 9. So in that time, if you are presenting a diagram means it will be easy to if you know the diagram, you can draw that one. Properly labeled neat diagram should you have to write that.
Any other doubts? Otherwise,
Okay, any other questions?
okay. Can we wind up? Yes. As we come to the end of this revision section,
Okay, we
I
hope
want
you got your medical surgical nursing 2 syllabus.
as we come to the end of this revision section,